Good morning, America, and good evening, India. Yes, Corona again. No need to panic, say researchers. Is this the beginning of another stage of novel coronavirus? Are there deadliest strains of COVID 19? These are some of the questions top researchers have answered about SARS CoV 2. More often than not, researchers have flagged concern over the deadly coronavirus mutating and evolving, expressing fears that it could delay the development of a vaccine. And even as the cure seems some time away, a reinfection case from Hong Kong has unnerved many. Is this the beginning of another stage of pandemic? Are there deadliest strains of the SARS-CoV-2? How long does the immunity last once a person has recovered? This and several other questions have gained traction since a 33-year-old man who returned to Hong Kong from Europe in mid-August tested positive after recovering from the first infection in March. It was Dr. Kelvin, a microbiologist and clinical associate professor at HKU Faculty of Medicine, who led the team of researchers into discovering the first documented case of coronavirus reinfection. The team used a genomic sequence analysis to find that the patient was infected by two different strains of the same virus. Dr. Kelvin, however, sounded caution when asked whether vaccination can be the guarantee against reinfection. Immunity is better a few months after recovery. We cannot be sure, but vaccination will surely provide protection, he says. Apart from Hong Kong, various media outlets have reported two cases of reinfection from Europe, including ones in Italy. However, the Italian government has not confirmed yet. Marike Jagan, deputy press officer at Germany's Robert Koch Institute, told India Today there have been cases in Germany which some weeks after their original infection had a positive PCR test result again. But the most likely and frequent cause is the persistence of virus RNA in the sample, not actual reinfection. I do not know of actual reinfection here in Germany so far compared to the Hong Kong case, which was infected by genetically distinct virus subtypes. The French embassy in India said there have been no reported cases of reinfection in France at the moment, but this is not a topic on which the embassy can provide accurate information. The World Health Organization too has warned against jumping to conclusions based on the confirmed reinfection case. Back home, even the Indian Council of Medical Research, ICMR, the country's top health science body, said there is no need to be alarmed immensely over the reinfection case in Hong Kong. At the same time, it said it is not yet known how long immunity lasts in the case of coronavirus. Addressing a press briefing on Tuesday, ICMR Director General Balram Bhargava said the Hong Kong case is a stray example and reinfection can depend upon virus factor. We have read the reports of one reinfection case in Hong Kong. We are learning more and more about the disease as we move ahead. It can depend on several factors. One can be related to the patient himself. How is immunity? How was his immune status? Was it compromised? It can also depend upon the virus, whether it has mutated or turned virulent, Bhargava said. However, only one case of reinfection has been reported, and it is very rare of viral infections. The ICMR DNG added, citing the example of measles, he said, once it affects, it gives lifelong immunity. Rarely does one can get measles a second time. But for this disease, we need to find out how long the immunity lasts. We need to closely follow it up, but at the same time, we don't need to be alarmed immensely about it, Bhargav said. Vaccination and antibodies. But we can herd immunity and or vaccination prevent the spread of coronavirus. Dr. Kelvin and his team made some statements in their research paper, parts of which Science magazine has seen it is unlikely that herd immunity can eliminate SARS-CoV-2 second. Vaccines may not be able to provide lifelong protection against COVID-19, the author writes. The researchers told Time magazine that there have been other documented cases of patients who have tested positive for COVID-19 multiple times, but it is not clear whether they are truly reinfected or if some of the virus genetic material lingers within the body. However, Akiko Lavaxi, a professor of immunobiology at the Yale School of Medicine, sees a positive side to the Hong Kong reinfection case. There is no need to panic over the news, even though he got reinfected. It is a good example of how immunity should work in a person, he told Time magazine. According to the researcher from the University of Washington, people infected with COVID develop antibodies with neutralizing power that can protect them from reinfection. The study demonstrates immunity in human beings, raising hopes that vaccine will be effective against the disease. Behind the report, Posak TV USA.